They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever. Ideally, you don't take it at all, but if you can't tough it out, if there's a problem, you're going to end up doing it.
President Donald Trump made an announcement this afternoon alongside Health and Human Services Secretary Robert F. Kennedy Jr. about his administration's latest findings on autism. And tonight we have reaction to this announcement as the U.S. Food and Drug Administration will recommend this advice to doctors and pregnant women. Good evening, I'm Scott Levin.
And I'm Mary Alice Demler. 2 on your side's Chelsea Swift joins us in the studio after hearing from medical experts. Chelsea?
Scott and Mary Alice, one local doctor says there are a variety of studies that indicate that Tylenol is safe and others that suggest the drug can be harmful to pregnant patients. Dr. Waters from UB says he believes more funding is needed for women's health to provide answers about autism.
FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism.
Health and Human Services Secretary Robert F. Kennedy Jr. says the FDA will now advise women to limit acetaminophen use, the main ingredient in Tylenol. The chief of maternal fetal medicine at UB weighs in on the topic.
There have been studies that reported an association between Tylenol and long-term health of newborns. There are others that have refuted it. I think it's kind of challenging because these are associations. They don't necessarily even tell us about causation.
Dr. Waters adds the American College of Obstetricians and Gynecologists considers Tylenol to be a reasonable therapy for pregnant patients.
It obviously needs to be done for a good medical reason because any medicine carries risk, even if they're mild, and to make sure that it's being taken for good reason.
The National Institutes of Health launching the Autism Data Science Initiative, the organization devoting an additional $50 million to autism research.
Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem.
Neurodevelopmental disorders are thought to be multifactorial, meaning that they come from a wide array of exposures of predisposition and of risk.
Dr. Waters says more research is needed.
Funding science for women's health and funding science for pregnancy health is critically important. It's been historically poorly funded, and it's why we have frustrating and confusing and challenging answers like this.
The FDA also approving a version of a drug called leucovorin as a treatment for autism. The medication was previously approved for chemotherapy patients. On your side in the studio, Chelsea Swift, Channel 2 News.
Thank you.